Good afternoon, ladies and gentlemen, and welcome to the Managing Your Meaningful Use Attestations with PQRS submissions. Your host today is Rebecca. Rebecca, please go ahead.
Thank you. Hi, everyone. Good afternoon, and welcome to today's webinar presented by Lake Superior Quality Innovation Network. I'm Rebecca Cavarella, Senior Clinical Quality Consultant at EMPRO, and today's slides will be available within the next week on our YouTube channel. So we are going to get started talking, just to give you guys a quick background on Lake Superior. Stratus Health in Minnesota, EMPRO in Michigan, and Medistar in Wisconsin have partnered as Lake Superior Quality Innovation Network to support the Centers for Medicare and Medicaid Services priorities for healthcare quality improvement initiatives in each organization's respective states. Together, we work collaboratively to improve healthcare for Medicare beneficiaries, share best practices, and maximize efficiencies. So our team is made up of the four of us throughout the state. These would be your main contacts. There's myself, Rebecca Cavarella, also Holly Stanhart, who will also be speaking today, and then Christopher Becker from Medistar and Jane McGrath from Stratus Health. So our objectives for every participant today is to be able to identify how to obtain the CMS Electronic Health Record EHR Certification ID for attestation. Also to be able to understand how to submit meaningful use objectives, be able to effectively prepare for a meaningful use audit, understand how to register for a CMS Enterprise Identity Management account, and identify the necessary user roles, and then also to gain knowledge of submission of physician quality reporting systems measures when reporting with an EHR. Okay, so I would just like to take time to mention that today's meaningful use material is going to solely focus on preparation for attestation and ensure that you are prepared in the event that you are chosen for a meaningful use audit. In addition, because we have callers from 3 different states, Minnesota, Wisconsin, and Michigan, we will only be covering the Medicare EHR incentive program attestation. So please feel free to contact your state's QIO for specific Medicaid EHR incentive program questions. All right, so let's get started. Here are a few things that we are going to discuss today and all the things that you will need to make sure that are in order before you attest. First, a quick review of the final rule changes. Next, you will need your NPES or NPI username and password. Then, your 2014 EHR CMS Certification ID number. Then you need to make sure you have all your reports, screenshots, and vendor letters saved in a folder that you can utilize in case of an audit as well. Once all these things are completed, you are going to be ready to attest. Okay, so a quick review about the final rule that came out in October. Now, there are only 10 objectives to report on along with your 9 clinical quality measures, or CQMs. For 2015 only, the reporting period is for any 90 consecutive days within the year. And then lastly, the attestation reporting period is January 4th to February 29th, 2016. Okay, so in the event that you or your provider has lost the login information that you will need for attestation or even just registration, don't worry. The CMS External User Services Help Desk will be able to provide you with the username, and they will also be able to reset your password. Just a heads up though, if you are calling for a provider and your name is not listed as an authorized entity under the provider's NPI, then the EUS Help Desk will need to speak with the provider directly. Okay, so moving on. The next item to complete is obtaining your CMS EHR Certification ID number. For those of us that are familiar with doing this, we refer to this as the Chapel website. This address is found at the top of this slide. Once you have entered the Chapel website, you will come to this page where you need to select how to search for your 2014 certified EHR system. This can be done by choosing vendor name or chapel product number from the drop-down and then putting the appropriate information in the text box. Just as a side note, you are only able to search for 2014 certified systems. If you want to look up any previous systems, for example, 2011 or a combination of 2011 and 2014, you can download the complete list by selecting the red arrow icon. Okay, once you have made your selection, you will select the search button and it will take you to the next screen. On the screen, you can filter your search from the selections on the left. There possibly could be several options for you to choose from. You will need to pick the option that best fits your product. This may require you to look into the additional software that you have installed on your system. Some will have different e-prescribing software or education libraries. If you are still unaware which one you should select, then you will want to reach out to your vendor for certain specifications. When you find the correct version, you will select the checkbox next to it and then click on the arrow under your product. Okay, now you will need to select the View Progress button. Okay, so once you do that, once you're on this page, you will then select the Get Certification ID button, and then your CMS Certification ID will appear. From this screen, you can select to have the information emailed to you, which is a very good way to keep a copy for your records. You can also print it to put in your audit folder. Okay, so speaking of the folder, we encourage everyone to keep all their meaningful use documents and reports in a binder. This binder should be able to house all the reports and should be separated out by individual attestation years. If your folder is put together and complete with all that we suggest in the next few slides, then you will be prepared for attestation as well as a meaningful use pre- or post-payment audit if you are chosen for one. So first thing you will need will be the actual meaningful use reports that are generated from your EHR that you will be using for attestation. Make sure the report has on it the provider name and the EHR system. If your meaningful use reports do not print out with this information, then you will need to take screenshots of the process of how you printed that meaningful use report. When you are printing this report, make sure you are printing core, menu, and CQMs with the correct reporting period date. If your EHR system has already been updated to reflect the final rule, then it will only have the 10 objectives and CQMs. You will need to make sure that you have a copy of your completed or updated security risk assessment that specifically identifies any mitigation plans or steps that you plan to take to correct any security inefficiencies that have been discovered during your assessment. CMS has a creative, interactive tool that they developed. You simply answer questions that they provide, and then the tool will generate a risk assessment report that you will be able to print off and work from. That link will be shared at the end of this presentation on the resource slide. Okay, so in addition to keeping a copy of your meaningful use reports and the security risk assessment, you need to keep a copy of your screenshots and vendor letters that prove that certain functions are turned on and are working in the EHR during your reporting period. For an example, taking a screenshot of all your CDS alerts that are set up in your system, a screenshot of your drug formulary working as a prescription is prescribed, and of your drug-to-drug and drug-to-allergy interaction warning. You will also need a letter from your vendor confirming that the secure messaging was enabled during the whole reporting period. This letter can also include verification of the other measures that require screenshots for more documentation. If all of these things are kept in a binder or folder in a safe place and you know where it is and you don't lose it, you will then be very prepared in the event of an audit. Even better, when you have all of the criteria completed, you have your login info, your EHR certification ID number, all of your reports and screenshots organized, you are now ready to attest for meaningful use. Okay, so the registration and attestation system can be found at ehrincentives.cms.gov. Just as a refresher, you will have to go through some CMS literature before you actually get to the login screen. So follow the continue buttons and follow directions in order to get into the login page. Once you have done that, and you will come to the login page. This is where you will enter your NPES or NPI username and password. If you are not the provider and you are attesting on the behalf of a provider or multiple providers, you are strongly encouraged to set up your own username and password and have the provider sign over the rights to you in order to attest for your provider. Please follow the instructions in this user guide to set this up. This is extremely helpful if you have multiple providers. This way you have access to all of the providers' meaningful use information all under one login. It will help you keep things very organized. Okay, so once you have logged in, you will come to the screen with all the tabs up at the top. If this is the provider's first time attesting, you must register first. It is also a good idea to review registration information and make sure that everything is still up to date. Once you have completed or reviewed your registration, you may go ahead and select the Attestation tab up at the top or the Attestation button with the blue arrow in the center of the page. Either one will get you to the attestation questions. Then from there, you will answer the meaningful use questions according to the meaningful use reports that you pulled from your system. As of right now, we do not have any additional information about the changes that are being made to the attestation process to reflect the final rule. If we receive anything before it is time to attest, we will send out information. Just a few reminders. In order to successfully attest for meaningful use, you must meet all of the 10 objectives unless you are excluded from one, and report on 9 CQMs across at least 3 different domains. If you require assistance, please do not hesitate to contact your state's QIO, MPRO for Michigan, Stratus Health for Minnesota, and Metastar for Wisconsin. Okay, so now to talk about audit. In the event that you or your provider is chosen for a meaningful use audit, you will receive a letter first via email that you used during registration on the registration and attestation system. They will then also mail one to the office address that is listed under registration. This is also why it is very important to review your registration every year. You will have approximately 2 weeks to compile all your information and return it to Figliozzi and Company. If you have kept all your meaningful use information in a folder as suggested, you will have it ready to go, and you shouldn't have any problem. The accompanied document is going to ask for particular information regarding your EHR. You will need to provide proof that you actually possess the EHR that you claim to have with that EHR certification ID number that you produced from the chapel list. You can provide licensing agreements or invoices from any upgrade, anything that verifies the physician or practice anything that verifies that the physician or practice has that system. They are also going to ask how many different offices or outpatient settings does the provider see patients at using EHR technology. Remember, meaningful use is by provider and not practice. So if the provider sees patients in multiple locations, those need to be included in your meaningful use numbers that you report during attestation. This can become quite cumbersome, so we encourage you to contact your QIO or rep for assistance with this part of meaningful use. The audit is also going to ask about how you store medical records. This means how is all your health information stored in your EHR, or is some information withheld from the EHR and kept in paper charts? They are looking to make sure that at least 80% of your medical records from your reporting period are maintained in your EHR. From there, they will list all of the meaningful use documentation that they want you to provide to them. Give them only what they want. Nothing more, nothing less. Provide the report from your EHR that you use to attest that represents your numbers for objectives and P2M, and then your screenshots and vendor letters for proof to the yes and no objectives. Remember, these are all things you collected in that folder, and you shouldn't have to worry if you have prepared correctly. If at any point you think you are going to need more time or have questions, do not hesitate to call the auditor. From my experience, they have been extremely accommodating and very helpful. Okay, so this concludes the meaningful use portion of the webinar. If you would like access to these slides in order to reference the links and material, they will be available on our website in about a week. Thank you, everyone, and at the end of this webinar, I will be around to answer any meaningful use-related questions. Thanks again, and here is Holly Standhart with her presentation on PQRS.
Thank you, Rebecca, for the information and the introduction. Hello, everyone. Again, my name is Holly Standhart, and I will be covering information on how to report when using your electronic health record. This information does not apply to those that are submitting their PQRS data either by claims or by, say, a separate standalone qualified registry or something that's separate from your EHR. For individual EPs who want to report their PQRS data electronically through their EHR, or for group practices that registered for electronic reporting using an EHR via GPRO, we will discuss the steps needed to submit the data to CMS for evaluation. So now we're going to go and get started on this presentation. The first two steps for physicians that have never participated in the PQRS reporting program or have new physicians that have just entered into the practice, steps 1 and 2 will apply to them. Keep in mind that the definition of an EP for PQRS and the definition of a eligible professional EP for meaningful use are different. As an example, registered dietitians, clinical social workers, and audiologists are considered eligible to participate in PQRS, but not necessarily in meaningful use. So for any information on that, please visit the CMS link for more information. Also, per CMS, only those EPs who render Part B Medicare physician fee schedule, either professional and or institutional services, are considered able to participate in PQRS and will be analyzed for future PQRS negative payment adjustments. Additionally, if you are new to PQRS reporting and need guidance on measures specifically are available for reporting for the remainder of 2015 and starting in 2016, you can visit the CMS link provided for more information. Also, since PQRS reporting is based on a full calendar year's worth of patient data, you want to make sure that you start this process as quickly as possible, especially since 2016 is quickly approaching. So after you have determined if you qualify for PQRS reporting based on your profession, and then you have selected the measures appropriate for your scope of work, you will then need to determine how your patient data will be submitted to CMS for review. There are a variety of ways that you are available to use, including claims, qualified registry, and for today's topic, through your EHR. For the purposes of this webinar, we are just going to discuss using your EHR as a means to submit your PQRS data. If you have a certified electronic health record, often referred to as a CERT, you may be able to submit your PQRS data using your EHR. You'll want to visit the ONC Chapel site that Rebecca referred to earlier, or alternatively, contact your vendor directly to see what options are available to you if you are considering using your EHR. If your vendor has been certified to submit your PQRS data through the EHR, it will be one of two different modalities. The first is the EHR data submission vendor, also known as the DSV. After you have entered your data into the EHR during the calendar year, when it comes time to report PQRS, your vendor will submit on your behalf. Please keep in mind, just because your EHR has the capabilities of submitting that data, doesn't necessarily mean that they will do it for you at the end of the year. You want to make sure that your contract specifically states that this will be done for you. Unfortunately, we've had a couple of events that we have seen that that was not the case. The second option that's available through EHR reporting for your PQRS data is called EHR Direct Vendor. This is different from the EHR Data Submission Vendor. Here you will still enter your data into the EHR. However, you will be responsible for uploading a specific type of file known as a Quality Reporting Documentation Architecture file, also known as a QRDA. You will be uploading that to CMS yourself versus in the EHR Data Submission Vendor where your vendor will upload it for you on your behalf. You'll need specific privileges set up to be able to upload that QRDA file if you choose the EHR Direct Vendor option. For EPs, if EPs are submitting PQRS data directly from their EHR system using the EHR Direct Vendor method, they must register for an EIDM account. It was formerly known as an IX account, but the Enterprise Identity Management account, EIDM, account provides physicians and other healthcare professionals a means to really access many CMS applications relating to PQRS. This is where you will request specific roles, specifically a submitter role, to be able to upload that special QRDA file to CMS, and then that's where CMS will evaluate your PQRS data. The EIDM account is really strictly used for maintaining your privileges. Also, EIDM accounts are not required if your EHR vendor will be submitting your data on your behalf. So as I spoke about the EHR data submission vendor, you don't specifically need that EIDM account because you won't be uploading those files. But if you are using alternatively the other method, then you will need to have an EIDM account. And then also, please keep in mind that there are other benefits to having an EIDM account for accessing other features relating to PQRS. So even though if you have your vendor that is submitting on your behalf, you still want to consider that EIDM account for other things, such as viewing feedback reports, basically how you are doing and how you have done with your PQRS, quality and resource use reports, which is part of the value-based modifier program, which is another layer of PQRS reporting. So now we're going to talk about how to create or access your EIDM account. To create your EIDM account, you will visit the CMS Enterprise Portal secure link above at https://portal.cms.gov. Here's where you will either create or manage your EIDM account. For those familiar with the formerly known IX account, it will be the same credentials that you used previously. Please keep in mind that if you haven't logged in for a while, you will be prompted to change your password, and you may have to answer your security questions as well. So as I mentioned earlier, there are several roles that are available to submitting your QRDA file for PQRS. Once you have registered or accessed your EIDM account, you will want to make sure that you have the correct role to submit your PQRS data. If you are using the EHR Direct Vendor modality, remember that this is not necessary if your vendor will be submitting your data on your behalf. There are a few roles that are available once the account has been accessed. These roles include the security official, the PQRS submitter, and also the end user. The security official is basically the first person that will register and registers the organization. They also have the ability to approve and maintain all roles within their organization, so any roles that are different from the security official. And then finally, the security official does not have access to submit data or retrieve any reports. This is very important to keep in mind because if you are going to be uploading that QRDA file for your PQRS submission, you will need to have a different role. For that role, you are going to be the PQRS submitter. That role, it has to be approved by the security official, and then also that role allows that practice to submit, that person can submit the PQRS EHR data directly to CMS, and then also the PQRS submitter can view the submission reports to see if the files uploaded correctly or if they failed. The last role that is available is the end user role, and that also has to be approved by the security official. It's the only role that has access to Qualitynet for the feedback report. And then this role is also optional but not necessary because there are other ways that you can request feedback reports as well. So also, the PQRS submitter role, as I mentioned earlier, is the role that will allow you to upload that special QRDA file needed for submission. If you were originally designated as a security official role in the EIDM account, you will need to appoint another representative affiliated with your practice as a PQRS submitter. You cannot maintain both roles individually. For detailed guides on and how to register for the security official or for PQRS submitter roles, please visit the following links. As always, if you run into any issues, you can always contact the Qualitynet help desk to assist you. The primary phone number is 866-288-8912. Again, that number is 866-288-8912. There will be a slide towards the end of this presentation if you missed that number, if you need additional information on that. Okay. Some corrections. Okay, so for submitting your PQRS, your data, the Secure Qualitynet portal can be accessed at https://www.qualitynet.org, which can be located on the next slide here. Once you select the login button at the top, you will select the appropriate designation, Physician Quality Reporting System. You will navigate through the main page to upload your QRDA file. And then toward the end of this presentation, there will be a handy user's guide that will walk you through the navigation process. Okay. So the typical process of submitting the QRDA file, here's an example of the workflow for submitting that information. Once the files have been uploaded by the final deadline date, which is typically the end of, toward the middle of March 20th, but that date is subject to change, it takes CMS until early fall to analyze the data. Once they have a feedback report, which will be available to the PQRS submitter or the end user, not the security official, you'll be able to view those reports. If discrepancies are found there in time to dispute those discrepancies, you have time to really just be able to get in there and work with CMS to see where those discrepancies exist. If the reporting requirements have not been met and a negative payment adjustment is applied, that adjustment will be applied the following year. So, for example, your PQRS reporting based on a calendar year will run from January 1st to December 31st of 2015. Then the Qualitynet portal, where you will submit your QRDA file, will open January 1st of 2016, where you can begin uploading and submitting your PQRS data. Your data will be due then by March 20th, 2016, and again, that date is subject to change, and then once that data has been submitted, any type of feedback reports that are available for the PQRS data that you have submitted, typically those are available by early fall. For anything, if you find any type of discrepancies, the informal disputes are typically available towards October, November, and then they typically close early winter. And then finally, if you are subject to a payment adjustment, that payment adjustment will be applied January 1st, 2017 to your Medicare claim. Okay, so just a helpful tool when you are submitting your QRDA files, there's something that is called a Submission Engine Validation Tool, also known as an SEVT. Prior to you uploading your QRDA file, you can run that SEVT to check the quality of your file. This file is located on the Physician Quality Reporting Portal, known as Qualitynet. The file validates the format of your data files for PQRS submission. So if there are any discrepancies or any issues with that file directly, this will tell you. And this is why it's very important to start submitting your files earlier on. Unfortunately, last year we had worked with a particular practice that experienced issues with the file, and then they had to go back to their vendor to have their vendor correct that QRDA file. And it took a couple of weeks, so the point is don't wait to the last minute to do this. And then in order to be able to access the SEVT, you must have an EIDM account set up, which is then again located and reverted back over to the Qualitynet. If you have any questions on how to run that submission engine validation tool, here's a user guide. It's very easy to do. Again, it is just very quick to be able to run that file. So I have some additional resources available as promised. Here is the contact information for the Qualitynet Help Desk if you run into problems with creating your EIDM account, or if you run into problems uploading your QRDA file. They are very helpful. They can walk you through step by step. And then also, too, I've included a handy reference guide from CMS that outlines the steps to report via your EHR. It's a really well-crafted document. I highly suggest accessing that. So I just want to take a brief moment to talk about our quality improvement initiative. We, in collaboration with the Lake Superior Quality Innovation Network, we have several initiatives that we have been granted to work on until 2019. The Lake Superior Quinn has received funding from CMS to focus on healthcare quality improvement initiatives. And some of those include improving cardiac health, reducing disparities in diabetes, prevention coordination through health information technology, which is your meaningful use, reducing healthcare-associated infections in hospitals, healthcare-acquired conditions in nursing homes, and then improving care coordination between healthcare settings. Also, the one that we are focusing on today is improving quality through performance-based initiatives, incentives and reporting systems, also known as PQRS and value-based modifiers. And then also identification of behavioral health conditions, and finally, improving adult immunizations, and that is just for the state of Michigan only. Benefits of participation, you can access learning sessions and educational opportunities, peer-to-peer learning and solution sharing, also beneficiary participation in patient-relevant meetings. Also, you can collaborate with partners and stakeholders and peers, and then also share knowledge about your successful interventions, and then we also offer continuing educational opportunities. And also, to get involved, participation is voluntary and it is free of charge, so we encourage you to take advantage of all of the initiatives that we have available. To join, participants must commit to the following: sign a non-binding participation agreement, timely submission of data based on the initiative and when requested, and then also active participation for the duration of the project, including attending educational offerings like those that are offered today. And then if for more information about these initiatives in the states of Michigan, Minnesota, and Wisconsin, please contact Christy in Michigan, Jerry in Minnesota, or Jody in Wisconsin, and they should be able to guide you through registering for these programs if you are interested. So now we are going to open the line for any questions that you may have. Before doing so, we have some evaluation questions that we would hope that you can fill out. Please take a moment to let us know how we did on this presentation, and operator, if you can open the lines up for our participants.
Ladies and gentlemen, if you have any questions at this time, please press the number 1 key on your phone. Again, if you have any questions, please press the number 1 key on your phone.
That WebEx being recorded?
Yes. Sorry, our first question is from Tammy with Rangeley Family Medical Center. Tammy, please go ahead.
I was asking if this WebEx was being recorded, that we could watch it again later. Yes, the presentation is being recorded and it will be available on our YouTube page within the next week or two. You can find the link to that page in the chat.
Okay, thank you.
Okay, we have no further questions waiting.
Hi, can you please pull up the evaluation for everyone? Thank you.
Okay, well, since there are no further questions, this will conclude our presentation for today. Thank you again for joining us for our presentation on preparing for meaningful use attestations and PQRS submissions. Again, the slides will be available on our Lake Superior Quality Innovation Network YouTube page within the next week. You can visit us at lsqin.org. And thank you again, and happy holidays to you. Take care.
Ladies and gentlemen, that concludes your call. You may now disconnect your lines.